You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, it's a special edition, by the way, replacing missing teeth with dental implants in just one day. According to my first guest, he says no one should be wearing a loose-fitting denture. We've had him on the program before, Dr. Jonathan Abenaim. Dr. Abenaim, welcome to the program.
Hey, Randy, how are you? Thanks for having me again.
Good, good. Now, you brought a stack of photos, so we'll get to as many as possible. And people need to know, I'm not trying to endorse you, but you are probably the most successful and the most experienced guy in all of New Jersey. I mean, you are the go-to guy in New Jersey for this procedure. And you do it in 3 appointments. No teeth. Like the day after tomorrow, I put you on the spot. The day after tomorrow, somebody watching this, if you had an opening, would get their new teeth.
48 hours.
Is that true?
Done.
Okay, good. So let's start with, for people that don't know your center, who's the typical patient that gets implants?
You know, a typical patient is a patient that, say, for many years didn't go to the dentist. Said maybe, I don't really deserve to have a beautiful smile, I don't deserve to look great, and they've just been hiding. And now they decided, you know what, I don't want to live like this anymore. I want to have a beautiful life, I want to feel great. They say to me, I am not living the way I was 5, 10, 15 years ago, and it stops me from everything. You would think about it, something as simple as teeth, people say, oh, it's just teeth.
Yeah.
But you know who says that? People that have teeth.
Okay.
When you don't have teeth, or you don't have the teeth that look the way you want them, or the teeth that function the way that they should, it's not a way to live. It's like one piece of you that's missing. And then it changes your whole psyche. Imagine you meet somebody, the first thing you want to do is smile and be nice to them. And say, hey, how are you? Nice to meet you. My name's Jonathan. And you can't do that. You have to close your mouth, and you have to be reserved. And it just sort of dominoes in their life. And when we're able to do this procedure for them, it's not just about teeth, it's not just about eating, it changes everything about them. They get new jobs, they get new relationships, they are living the way they really want to live. And it's amazing. I would say, sometimes I tell them on the day of their surgery, today's your birthday. This is the first day of the rest of your life.
You said they all have regrets.
Yeah, you know, one of the things we asked them at the end of the treatment, once they have their beautiful new smile, and I said to them, what would you tell somebody if they were asking you, should I do this? And they say, I wish I would have done it sooner. Just get this done. You know, fear is a big thing. It stops people from getting what they want. And, you know, it's not easy to pick up the phone and call. It's because all of these years you've been telling yourself, I'm fine the way I am. I don't need to spend the money. I don't want to go through the procedure. I don't want to do this. But picking up the phone and stepping up for yourself to say, now this is for me. I've taken care of everybody in my life. But now I want to take care of me, because not only is I want to look good, I want to feel good, but I want to be healthy. I want to live a long time. And I tell people all the time, if you're not good, if you're not able to take care of you, how are you going to take care of the people that you love?
So what do they like more? The way it looks or what they could eat? If you had to...
In the beginning, you know, we asked them, what is it that you want? They say, well, I'm not vain. You know, everybody says, I'm not vain. I don't care the way that it looks. But let me tell you something. When you can have the whole thing, you can have it look great. You can be able to function the way that you want, to never have to worry about them falling out, to never have to worry about them breaking. It's like, wow, I just got everything I even asked for it.
So now your center, and correct me if I'm wrong. I mean, normally the dental implants are done in 2 places.
Yeah.
The person that does the surgery, the person that makes the teeth, and then they send everything out to a lab. You said over there that you actually make the teeth yourself. I said yourself, meaning an in-house lab. Yes, but you said you paint the teeth. That means the gums, the teeth. You do that like a lab technician.
Exactly. I tell my patients on the first day that I meet them, I want to get to know them. I want to know who they are. I want to know where they come from. I want to know their personality, because you know, there's a disconnect. You may go to the surgeon, you may go to the restorative dentist, and then the lab has to be able to put the vision from a piece of paper that you write. I'm able to do the surgery. I know where the teeth are going to be. I'm able to create the position of where the teeth are going to be. But then I go ahead and I sit in the lab. I take a paintbrush and I put multiple colors based on the personality that you told me you are, based on the way that I met you, and based on the way that your dream of how you wanted to smile. And I'm able to put your whole character of who you are into the tooth, because I do it. Me.
Now you teach. And we should mention this too. You teach dentists from all over the world on how to do this process. You call it a digital workflow. Everything's done on the computer.
Yeah.
And you have what? They make the teeth like on a mill or digital printer in your office.
Yeah, so I invented a process called the Excel implant process.
Okay.
I have multiple patents in the way that the process is done, the way that the parts are done. And I did this because when I started doing this 20 years ago, I said, this is not the way to treat patients, the way that it's always been done. Go to different doctors, spend multiple hours, multiple months to get this done. So I invented this, I invented parts, I invented screws, and then I decided, you know what, I'm going to teach it. And I started teaching it not nationally, but internationally, and it's unbelievable. I was able to help a lot of doctors, help a lot of patients.
You know, I probably didn't tell you this, but look, our show's been around for 25 years now, airing on TV. I've interviewed lots of dentists. If you're an implant dentist, and the ones that everyone knows who you are. I mean, I think you can't be a serious implant dentist by not knowing Dr. Abenaim. And I'm not just buttering you up. I mean, this is kind of a fact. Does it cost more to go to a guy like you?
No, not really. Actually, it probably costs less because I do everything. I invented the parts. I make the parts. I make the teeth. And then because of my process and the way that we've perfected it, they say a surgery that would take 6 to 8 to 10 hours anywhere else, we do it in 2.
And I told you in the green room, I said, look, I talked to a dentist that said, in reality, says it takes about a year before you get them to the upper and lower teeth that don't come out. What do you say to something like that? Because that's what patients have to go through, right?
Yeah, and I wouldn't want to say that it's sad, but you don't know what you don't know. And with my inventions, with the materials that we have available today, and with the techniques, we could take a patient from A to Z as fast as 3 weeks.
How old is your oldest patient?
My oldest one, 95.
95. They got upper and lower teeth.
Upper and lower teeth.
Supported by dental implants.
3 hours.
Why would a 95-year-old want to do this?
I asked her that amazing question, and I said to her, why do you want to do this? I want to know. She said to me, Jonathan, even if I live 2 years, I want it to be the best 2 years of my life. She's lived way more than 2 years. She was 89 when I started.
Okay.
Right? She's 95 now. And she's able to eat. She's able to live. Because think about it. If you cannot nourish yourself with healthy food, how are you going to live a long time? And when you don't have healthy teeth, you're not able to do that. You know, I did a patient last week, a Parkinson's patient. She said to me, ever since you did my surgery, it's only been 2 weeks out, she said to me, my tremors went down. And it's not because we cured her Parkinson's, but what we did for her was we took away the anxiety. The anxiety of having non-healthy teeth or not even able to smile. And she looks unbelievable today. And we're not even done. And that is to be able to do that for people, to be able to change their life in something as just fixing their teeth. And that's powerful.
You told me. You said, Randy, I'm not changing their lives. They are. Can you elaborate on that?
Yeah, you know, you can only change your life if you want to. You can see the show. People watch the show 1 month, 2 months, 6 months, 5 years. They've been watching the show, and then finally they say, now's the time. They pick up the phone and they say, now I'm going to call. And that's the first step. I say, stand for yourself. Make the phone call. Come in and meet us. Come in for the consultation.
Do they all get to meet you?
They all get to meet me.
Okay.
And meet us, see what we can do for you, see how we can really help you, and then make the decision if you deserve it. Because that's really, at the end of the day, you have to stand for you. And we're going to be there with you all the way.
I'm paraphrasing you slightly. You said, in the green room again, you said, we don't pressure people. No. We don't try to talk people into this at my office.
Yeah, you know.
What do you mean by that?
I've been asking people, your teeth are the way that they are. It's been so long. It didn't happen overnight. Why did you not do this? And they say to me, I didn't know you existed. I didn't know this was an option. So people have a problem with their teeth, and we're just here to help them. And we never want to tell anyone, you got to do this. We tell you it's important to do this, and if you want to do this, get on the journey with us, and we'll help you change your life. So let's do it together.
Very nice.
Yeah.
That's very nice. Okay, you brought a stack of photos. Let's take a look.
Yes. So here's my first patient. I remember Deborah. She is truly unbelievable. She was a really, really happy patient, but she decided that enough is enough. She decided that she is going to become healthy. She decided to start eating healthy, to be able to start exercising, to just be who she wanted to be.
Okay.
And she said to me, you know what? The last thing for me on my journey is I need to fix my teeth. And let me tell you something.
Like she would have been in a denture.
She would have been in a denture. She was in pain. Her teeth were decayed. She was missing teeth. She wasn't able to smile the way that she wanted. She didn't feel like herself, right? You see this beautiful person, but they're just holding themselves back. And let me tell you, if you see her after the picture, I mean, look how lit up her eyes are. And when she finished the case, when we showed her in the picture, this is what she did. She went, oh my God, she couldn't believe, as if she hadn't seen her real self all this time. She finally got to see herself. And that is so powerful to be part of, to be able to do that for someone. Imagine you look in the mirror and you don't see yourself, and then finally one day, boom, it's you, the person that you
She does look like a different person. Because like, as you mentioned, look, people with bad teeth are judged. And that all goes away.
Unfortunately. But I think the biggest people, they judge themselves. And because they think,
good point.
Yeah, they think that maybe people are looking at them. But in reality, who doesn't want to feel great? Who wants to have their body fighting infection? Who wants to have to take out their teeth at night? We want to be able to help you get to where you deserve to be.
But what if you have bad gums? Can you do this? Like the real, bad gums? Do the implants stay in there?
Well, bad gums is because you got bad teeth. And once we get rid of the infection's gone. But here's the beautiful thing is, once we finish your case, you're a patient for life. We see you every couple months. We make sure that you do not fall off the bandwagon. You are with us, and you will be making sure that your treatment is successful throughout the life of your implants and the life of your life to be able to get to where you want to be and maintain what you want. So we take that journey with you. We don't just fix your teeth and send you on your way. You now become part of our family, and we maintain you through the whole time.
Okay, good. A couple more.
All right, here's another one. This is Robert.
All right.
So Robert, unfortunately, had a stroke, and he was told he would never walk again. And let me tell you about this man. This man is a person that really stands for himself. He decided to rehabilitate himself to really get to where he wanted to control his health. So he went to the doctors, he did everything. But again, the last thing was his teeth, right? He wasn't walking the way exactly he was before his stroke, but he couldn't smile. Even if he felt like, my God, I was able to save myself and get to where he was. And now, I give him teeth. He's able to smile. Take a look at this. I mean, look at his eyes. Look at his hair. He is unbelievable.
Different guy.
I mean, it's amazing. The beautiful thing is to be part of that. It's not just about fixing their teeth, but to be able to be part of changing their life. And not only that, to do it predictably. My process, my Excel implant process, is no more guessing. So many times people go to the dentist and they've been promised that A, B, and C is going to happen, and then they get, I would say, let down, or like dentistry has let them down. So they disappear from the dentist. They never go again. But my process is so precise, it's so calculated because of the way we use computers and robots and my patented process.
Robots?
Yeah, robots, to be able to create everything exactly the way it needs to be done. It's unique in the way that we do things. There's nowhere else in the world that can do this.
You're very proud of it.
It was my passion for life. It took me a very long time to think about it, to make it happen, and to perfect it to the point where now we know exactly. I have a patient come in and say, well, have you ever done a case like mine? Mine's the worst. And I'm like, let me show you. I've done this case. I've done exactly this case because we've done so many to help so many people to really help change your life. I say change your life over and over because it's huge. So I want you to just look at Robert. Look at his after picture, how he smiles. Do you see how his teeth just blend with his face? It's as if they were there forever. And although we think that, okay, he has a nice smile, so many calculations, so much process has to go into it that we couldn't do before. Before we had to go back and forth. And at one point we were tired of going back and forth so many times, like, it's okay. You see people and you're like, who did your teeth? As opposed to my patients, people say, wow, you have a beautiful smile. They never
those
know.
do look natural, and I'm not trying to side with you. I mean, that looks natural. So that's because of this digital process.
Yes, this process that I invented.
Done on the computer first.
Everything on the computer. Everything is measured exactly. We look at your eyes, we look at your face, we look at everything to be able to look. So take a look at this patient.
Okay.
You could even see. This is Clarence. Here's his before picture. And what's interesting is that he saw one of my patients. One of my patients was his friend. And he said to him, whoa, you got a really nice smile. What happened to you? And he told him, I went to see Dr. Jonathan, and you need to go see him. He came in, you look at his before picture, he's missing teeth, he's wearing a partial denture, he takes out his teeth, doesn't feel the way that he wants to feel. But most importantly, he had this lucky charm in his denture. And there was something that he wanted to be able to transfer.
What do you mean a lucky charm?
He had this little lucky charm that was embedded into his denture, and he said to me, Dr. John, I'll let you fix my teeth if you can make sure that my lucky charm is in my permanent teeth. So because I customized everything.
Like a little diamond or a little?
Yeah, a little piece of gold.
Okay.
That we were able to just transfer into him, and he feels amazing. This man comes in like I like you think he's 10 or 15 years younger. He comes in, he's loud, he's smiling, he's like grateful. He's just so happy that he did this. I mean, look at his after picture. Take a look at this. This is huge. I mean, you can just see it in his eyes.
So he can like eat, like if he wants to eat something really hard, like nuts or a steak or whatever. I mean, does he have to be careful a little bit?
So we tell people, whatever would break your natural teeth would break your implants. At the end of the day, you got to eat normal. You want to eat steak? You could eat steak. You're not going to go and bite on a bone, right? You want to eat chicken wings? You could eat chicken wings. You're not going to go eat rocks. You're not going to go chew on ice. That's not the right thing to do. Can you do it? Possibly, but you may risk breaking it. Because the same way you'd break your own teeth. Okay, so this is Donna. She came in. She is a wonderful, wonderful individual. And she said to me, listen, I am getting close to retirement. I want to feel great. I want to travel. I want to go out with my friends. I'm very social. I am done taking my teeth in and out. What can you do to help me? And we looked at her. We did all measurements. And we said, I could really change your life. She said to me, I'm so tired of this. My sister's been making fun of me my whole life. I really don't want this anymore. I want to be happy. And let me show you this. So Randy, take a look at her before and after. Look at it. Look at it side by side. You tell me, do you think she looks younger? Do you look she looks happier?
She definitely does, yes.
Isn't that amazing?
Definitely more sophisticated as well, and prettier.
Like she said to me, she wanted to feel confident again. And confidence does amazing things for people. It comes out in your body language to who you are. And I can talk about this for hours and hours. We only have a half an hour,
okay,
but
good.
This is amazing. Let me show you. This is an amazing one.
All right.
This is Noreen. Okay? Noreen is a firecracker, I describe her as. She has got her own boat. She goes out with her friends. But she said to me, I am tired of wearing this denture, and I don't want to wear a denture. I want to take care of myself. I don't care what anybody says. It's too much money. It's too little money. It's a big process. It's a little process. It doesn't matter to me. I need to change my life. I don't think you're ready for this after.
Okay, let's take a look. Oh, wow.
And let me tell you something
Looks
about
like Noreen. It could be the daughter of the before.
All right. And Noreen went to multiple dentists before me, and she was told she doesn't have bone. She's not able to do this. Well,
but if you've been wearing a denture like 20 years, you can't do this. You don't have enough bone.
That's what everybody says. That's not true anymore. Now with our new techniques that we have, and when I say new, it's very, very predictable. We're able to give almost anybody teeth. If you can get in a car, like I say all the time, if you can get in a car and come and see me, I give you implants.
Okay, now I interrupted you. So this before and after, she does look dramatically different. What does she say when she looks at the mirror for the first time and sees this?
They say, "Is that me?" Because they've been looking for that me for so long. They've been looking for that version of themselves. Because at one point they had teeth, right? They felt young. They felt great. But that person was gone for multiple years. And then they finally said, now it's time for me. I'm doing this. Good. And then they go through it. And look, they change their hair, their smile, their eyes light up. It's just truly unbelievable.
It's a big deal. You know what I'm noticing? Look, I met you and interviewed you about 5 years ago, but it's almost today you're more philosophical. Is it because you're figuring out that this is really a big deal?
It's a huge deal. For a long time when I started, we were just treating teeth. I don't treat teeth anymore. I treat people. Because I see how this effect is on them.
Do you see the end result? Like you're in a consult. They're telling you how bad things are. Do you ever get excited and go, man, they have no idea how good this is going to be?
Yeah, and sometimes they look at me and they say, wow. And I'm like, and I apologize because of how excited I am.
Oh, you get kind of,
I'm like, almost like I wouldn't say I hold back tears of sadness, but tears of so much enjoyment because I'm like, I know what you're going to look like, and I know how this is going to change your life. I need to do this for you. Let's find out any possible way to do this for you. And I hope they appreciate that because, I really take this to heart because, this is something that I'm able to do for people, and I believe they all deserve it, and they should do it.
We haven't really talked about it, but obviously they're numbed up, but sedation?
Yes.
On every one of these patients?
So you can think, I would say probably 90% of the people that come to see me are afraid of the dentist. That's one of the reasons they're like this. So we have sedation with a board-certified anesthesiologist, and he sedates them, and takes about 2.5, 3 hours. They wake up, they have brand new teeth, and they open their eyes and they say, "Oh my God!" And it's one of the favorite reactions. And then we make their final teeth, and then they say, "Oh my God" again, and then they go and they live their most beautiful life.
And this can be done. Look, they go in. and again, I want to make sure I'm not putting words in your mouth. They go in, they meet you.
Yep.
They come back, and you actually do the procedure?
8 o'clock. Let's say 8 a.m. is their first surgery. 10:30, 11 o'clock, they wake up, they walk out, they have teeth.
I've been told, though, that many doctors put them in a denture for a month, let the implants heal, or grab onto the bone, grabs onto the implants. Is that just old thinking, in your opinion?
I believe it's old thinking. You know,
Okay.
we have such amazing techniques, such amazing materials, and we understand the biology of bone more than we've ever before. And we're able to give people teeth the same day. And we do it very predictably. I would say almost close to 100%. And why put a patient through a denture? They came to see you to take them out of a denture. Why put them in a denture
Now,
any
snap
longer?
in, snap out teeth. It seems like all the new guys want to do this. You're not a fan of these snap in, snap out. In fact, most of the advertising, you told me, that people see are for snap in teeth.
Yeah.
You don't like them. Why?
People don't want dentures, and because of the way
Because
that
the patients don't like them.
the patients don't like them, they still move, they still get food stuck under them, and because of the way that my process was designed, the same cost for a snap-in and snap-in denture, I can give them permanent fixed teeth. Why wouldn't I do that?
Okay.
We're able to say because inevitably they will want permanent teeth. Nobody wants to take out their teeth, even if they snap in and snap out. This is old thinking. I want to be able to smile.
But I hear dentists that will say, but Randy, they like that.
They don't. They really don't.
Is it just because it's easy? I'm trying to figure this out. Why are all the new guys doing it? Is it because it's easier to do these snap in, snap outs?
Yeah, it takes less experience to be able to do a denture because you can place the implants wherever you want. You can make a denture, hide everything. But to be able to do this perfectly, you need to have the right hands. You need to have steady hands. You have to have the technology. You have to have, even more important, the passion.
Do you feel like you're at the top of your game? Like, I know you don't want to brag about yourself on the show, but do you feel like you're one of the best guys in the country doing this? Do you feel that? Come on, do you or not?
I get to change a lot of people's lives.
Okay, good. Okay.
And I learn something every day from my patients on how to do this better and better and better.
I know you teach other dentists, but do you still go to continuing education training?
Yeah, we go to continuing education training to learn new things, whether it's nationally, internationally.
Do you have to wear a disguise at these meetings?
Sometimes, yes, because sometimes it takes away from the own speaker, right? But we're able to help. We're able to learn to really help, and I get more and more patents as I invent more and more things, and
the things you're inventing are to make the process faster,
easier,
more reliable,
yes,
less downtime.
Because because people have to understand that even though people used to get teeth, there were still some complications that existed. I took those complications and I solved them for the patients so that they don't have these problems anymore.
Good. I'm going to rush you.
All right.
Because we have just a couple of minutes left.
I got to show you. Let me show you this patient. This is David. I mean, this is before. He had 3 teeth left. I can go over his story. At the end of the day, he wanted to change his life and smile. Take a look at this. This is a huge deal.
Nice.
This guy is so happy. Okay, and I can talk to you about this forever, but I got to show you these pictures. This is another patient of mine. This is Dragon. This man was he's like, I'm not wearing a denture anymore. I don't want to have
Looks like a tough guy.
He's a police officer.
Okay.
And it was time. Let me show you his after.
Oh, wow.
And we can
now he looks like a nice guy.
Yeah, he was always a nice guy. And it was just for him to say, you know what he said to me? I wish I would have done this so much long ago. Because, I tell people, the problem is not going to go away. You decide, you're going to fix it now or fix it later. So why make it go even longer? Take a look at this patient. This is Robert. Here's his before. Okay? Robert decided, we're going to do one at a time. We did first his upper arch, then we did his lower arch, got rid of his denture. Look at how big he's smiling. He cannot stop smiling. I mean, this is huge.
You know what I like, by the way, we should mention, I mean, you're on Instagram, you're all over the internet.
Yes.
And your patients always want to pose with you.
Yeah. They're just so happy. And they're happy not for me, but for themselves. Because these are people that never do for themselves. They do for everybody else. And they finally took a stand and said, I am going to do for me. And they're just so happy. Okay. Let me give you this last patient. This is Miriam. She comes in and says to me, Doctor, just give me a beautiful smile. I don't leave my house. I don't smile. I can't live. Just fix me. This is her before. Look at her after.
That's nice.
It's truly a gift to be able to do this for these people. And
I mean, her smile looks better than yours.
Yeah, that people say that to me all the time. They say, "Whoa, your patients have better teeth than you."
Very nice. And you
fine.
did this all right there.
All right there. I did them all. Everything that you see on social media, it's all my creation. There's nobody else doing it. I'm the surgeon. I'm the restorative dentist, and I'm the lab technician.
Now, when I hear some of this, and respectfully, sometimes it sounds like an exaggeration that these people are just so happy with their new teeth. But they are, right?
Yeah.
It's not an exaggeration.
Imagine for all of these years. It's not. And you know what? It's not that I couldn't promise it unless I experienced it from these people. And I see them, and it's sort of something that they've been looking for their whole life, and they didn't know existed. Or they've been telling themselves they don't deserve it, or dentists have been telling them they cannot do it, and they have to be in a denture, or they have to stay with their broken teeth.
Okay.
And it was finally time for them to take a stand for themselves, research, watch a show, finally decide, I'm going to dial that phone number.
Now, you've been on TV now. I've had you on the program for a long time. Did you get recognized ever here and there in New Jersey?
Sometimes.
Did they ever ask about me?
Always.
I'm just kidding. I'm kidding. Okay, final message. Somebody's watching this show, and maybe they're like either the first time hearing this message or they've watched it over time, but they're skeptical. They're still skeptical, afraid, they can't justify doing it. What do you say to them?
Pick up the phone. Call, come meet my team. Our standards are very high, the way that we treat our patients, and the way that we do the treatment, the way that we execute the treatment is very high, and it's unbelievable. You deserve this. Do this for you. If you're not going to do this for yourself, nobody will do it for you. So finally say, now is my time. Spend a couple of weeks with me. I'm telling you, I can change your life.
Good for you. All right, Dr. Jonathan, always a pleasure to have you on the program. Excellent stuff. All of this is online?
Yes.
Do they make an appointment online or they call your office?
They can make an appointment online. They can call my office. They can follow us on social media. Every day we post more and more cases and more lives being changed. So super excited.
Good for you. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.